Hello, my name is Andrew Burgee, and I am the Hazardous Materials Training Coordinator for the NYU School of Global Public Health Hazardous Waste Worker Training Grant for our grantor NIEHS. Welcome to our COVID-19 Exposure Recognition module. This module focuses on the use of respiratory personal protective equipment beyond N95 half-face respirators. Specifically, we are looking at half-face respirators beyond N95s, full-face respirators, powered air purifying respirators, supplied air respirators, and self-contained breathing apparatuses. More information on our basic respiratory PPE is available in our other offerings. The alphabetical component of identifiers of respirators addresses the appropriateness of the equipment to filter out types of particulates in the air that may contain oil. The three categories of filtering facepiece respirators are not resistant to oil, oil resistant, and oil proof, or NRP. The numerical component of identifiers specifies the efficiency needed to block out the hazard in question. The target size is 0.3 microns. The three categories are 95, 99, and 100% efficiency. The ones used by healthcare workers are N95 respirators, which are sufficient work areas where contamination is known and controllable, which is displayed on the left. When contamination is known and controllable and oil particulates are potentially present, the P100 is the preferred control, which is displayed on the right. The assigned protection factor, or APF, of 10 means the respirator will protect up to 10 times the permissible exposure limit of the contaminant in question. The assigned protection factor, or APF, of 50 means that the respirator will protect up to 50 times the permissible exposure limit of the contaminant in question. This is possible due to the respiratory covering to the whole face beyond the mouth and nose. Eye protection is also enhanced in the process. Here are some examples of half-faced, full-faced, and powered air purifying respirators with HEPA or high-efficiency particulate air filters, which are magenta in color. The numerical component of identifiers specifies the efficiency needed to block out the hazard in question. Again, the target size is 0.3 microns. The three categories are 95, 99, and 100% efficiency. Particulates are filtered out by a combination of microcapture netting and electrostatic charging of particles, which traps the particles onto filter fibers, preventing them from entering the breathing zone of the user. This slide illustrates the minute size of the particulates in question. PM stands for particulate matter. Always conduct a seal check before using your respirator. This consists of a positive and negative pressure check. The negative check involves covering the filters and deeply inhaling. If worn correctly, the mask will collapse onto one's face. The positive check involves covering the exhale valve and exhaling deeply. If worn correctly, the mask will puff out and inflate. With both checks, be aware of any air leakage around the mask and minimize the leakage. Know how to recognize medical signs and symptoms that may limit or prevent you from using a respirator. Some medical conditions and symptoms include respiratory impairment, anemia, diabetes, epilepsy, cardiovascular impairment. Know how to recognize medical signs and symptoms that may limit or prevent you from using a respirator. Some medical conditions and symptoms include facial hair, comfort, vision, claustrophobia, and a punctured eardrum. To protect against filter breakthrough, understand the function of end-of-service life indicators, or ESLI, or shift-specific filter change-out protocols. Be familiar with the procedures for cleaning, inspecting, and storing respirators. The assigned protection factor means that the air inside the respirator is roughly a multiple times cleaner than the air outside the respirator, due to the proper wearing of a unit that is designed to filter out airborne hazards. In this displayed example, half-faced air purifying respirators have an assigned protection factor of 10, or 10 times the permissible exposure limit. Full-faced air purifying respirators have an assigned protection factor of 50, or 50 times the exposure limit. Powered air purifying respirators have an assigned protection factor of 25. A positively pressured filtered air supply of air is fed over the face of the wearer, allowing them to breathe clean air in a contaminated situation. Since a closed, tight-fit respirator is not required, having facial hair is possible with this option. Supplied air respirators have an assigned protection factor of 1,000. These are better than air purifying respirators because the remote source of air being fed to the user via air hose is pure and independent of filtration for cleanliness or potentially deficient ambient oxygen levels. Self-contained breathing apparatus air respirators have an assigned protection factor of 10,000. These are better than supplied air respirators because the source of air being fed to the user via an air hose is carried on one's back and pure and independent of filtration for cleanliness or potentially deficit ambient oxygen levels or crimping of air hoses. Respiratory protection beyond N95 is used when the concentration and duration of the contamination is very high and may not be able to be sufficiently filtered out by an air purifying respirator below a full face or cannot be safely filtered out at all, requiring a supplied air respirator. Biosafety Laboratory Level 3 and above that handle lethal pathogens like Ebola are good examples of when a PAPR or above is required. Know how to use respirators effectively in emergency situations, including situations in which the respirator doesn't work properly. Troubleshoot different types of respiratory types based on their benefits and shortcomings. Here are some limitations for various respiratory protections. For gas, vapor, particulate respirators, these are not for use in atmospheres immediately dangerous to life and health or oxygen deficient, which is below 19.5% oxygen. Regarding contamination, the filters need to be specific, whether it's by colors for gas or letters and numbers for particulates. Regarding SCBAs, the air supply is limited to what is carried on the back, so that could be between 30 to 45 minutes. Regarding airline respirators, you want to make sure that the hose length does not exceed 300 feet. And then finally, with powered air purifying respirators, you want to make sure that the air supply is not cut, because without the air supply, then you're not getting positive air pressure, which compromises your breathing integrity. High exposure risk populations are those working with people with known or suspected COVID-19, especially when performing aerosol or droplet generating procedures. Some work settings that have a high potential of exposure which may require higher respiratory PPE are as follows: healthcare, laboratories, emergency medical services. Some job activities that may have a high potential of exposure which may require higher respiratory PPE are as follows: care for COVID-19 patients, working with specimens in laboratories, and transport to hospitals. And then finally, some occupations that may have a high potential of exposure which may require higher respiratory PPE are as follows: healthcare worker, paramedic EMT, and laboratorian. This is a mini quiz. Please answer the following 4 questions. A half-face respirator has an assigned protection factor of 10, 50, 100, or 10,000. Which type of respiratory protection requires one to be clean shaven? A half-face respirator or a powered air purifying respirator? Which type of respiratory protection takes air hose length into account? Half-face respirator, powered air purifying respirator, supplied air respirator, or a self-contained breathing apparatus? Which type of respiratory protection protects best in an immediately dangerous to life and health scenario? Half-face respirator, powered air purifying respirator, or a self-contained breathing apparatus? When a high level of exposure is likely in your job duties, such as in a healthcare or laboratory setting, your respiratory selection of PPE will probably include one or more of the following: full-face respirators, powered air purifying respirators, supplied air respirators, or self-contained breathing apparatuses. Each respirator type must be protective of the hazard in question, and training must be conducted to ensure proper use. That concludes module number 5. Be safe and thank you for your time.